Welcome back to our channel where we dive into important health topics. In today's video we'll be discussing a serious condition known as ectopic pregnancy. This condition requires prompt medical attention, so it's essential to understand its definition, types, causes, symptoms, how it's diagnosed, and the management options available. An ectopic pregnancy occurs when a fertilized egg implants and grows outside the main cavity of the uterus. The most common location for an ectopic pregnancy is within one of the fallopian tubes, which is why it's often called a tubal pregnancy. However, ectopic pregnancies can also occur in other areas like the ovary, abdominal cavity, or the cervix. Types of ectopic pregnancy. Tubal pregnancy, the most common type, where the embryo implants in the fallopian tube. Within this category, implantation can occur in different parts of the tube. Ampullary, located in the ampulla, the widest section of the tube. Isthmic, located in the isthmus, the narrowest part of the tube. Fimbrial, near the fimbriae, the fringed ends of the fallopian tubes. Ovarian pregnancy implantation occurs in the ovary itself. Abdominal pregnancy, the embryo implants within the abdominal cavity. Cervical pregnancy, the embryo implants within the cervix, the lower part of the uterus. Interstitial pregnancy occurs when the embryo implants in the part of the fallopian tube that penetrates the muscular layer of the uterus. Several factors can increase the risk of having an ectopic pregnancy. Previous ectopic pregnancy. A history of ectopic pregnancy increases the risk of future occurrences. Tubal surgery. Surgeries such as tubal ligation or reconstructive surgery on the fallopian tubes can lead to scarring, which may cause an ectopic pregnancy. Infections, pelvic inflammatory disease, often caused by sexually transmitted infections like chlamydia or gonorrhea, can damage the fallopian tubes. Fertility treatments. Assisted reproductive technologies like in vitro fertilization may increase the risk. Contraceptive methods. Use of intrauterine devices or becoming pregnant after tubal ligation increases the likelihood of an ectopic pregnancy. Smoking has been linked to an increased risk of ectopic pregnancy. Maternal age. Women over the age of 35 are at higher risk. The symptoms of ectopic pregnancy often appear between the 4th and 12th weeks of pregnancy and may include sharp, stabbing abdominal pain. This pain is often one-sided and can be severe. Vaginal bleeding. Light to heavy bleeding that is different from your regular menstrual period. Shoulder pain. Pain in the shoulder, particularly when lying down, could indicate internal bleeding. Weakness or dizziness. These symptoms may suggest significant blood loss and shock. Nausea and vomiting often associated with the pain. If you experience any of these symptoms, especially severe abdominal pain or significant vaginal bleeding, seek immediate medical attention. Diagnosing an ectopic pregnancy involves several steps. Pelvic exam to check for tenderness, mass, or other signs in the abdomen. Transvaginal ultrasound. This is the most definitive test as it allows the doctor to visualize the uterus, fallopian tubes, and surrounding structures. Blood tests, serial measurements of the hormone HCG. In a normal pregnancy, HCG levels rise steadily, but in an ectopic pregnancy, the rise may be slower or plateau. Cholecystectomy, a rarely used procedure where a needle is inserted into the space behind the uterus through the vagina to check for blood from a ruptured ectopic pregnancy. The treatment of ectopic pregnancy depends on its size, location, and the woman's clinical stability. Medication methotrexate is often used to dissolve the ectopic tissue in cases where the tube hasn't ruptured and the pregnancy is small. It's a non-surgical option that requires close monitoring. Surgery. If the ectopic pregnancy is large, if there is significant internal bleeding, or if the tube is ruptured, surgery may be necessary. There are two main types of surgery: laparoscopic surgery, minimally invasive surgery where the ectopic tissue is removed, and if necessary, the affected fallopian tube is repaired or removed. Laparotomy, a more invasive surgery, typically used in emergencies, where a larger incision is made to remove the ectopic pregnancy and control bleeding. Expectant management. In some cases where the ectopic pregnancy is very small and not causing symptoms, the doctor may recommend careful monitoring without immediate intervention. This approach is only used in select cases with close follow-up. Ectopic pregnancy is a serious medical condition that requires prompt diagnosis and treatment. While it can be a frightening experience, early detection and appropriate management can significantly improve outcomes and preserve fertility. If you or someone you know is at risk or showing symptoms, it's crucial to seek medical attention immediately. Thank you for watching. If you found this video helpful, please like, share, and subscribe to our channel for more informative content. Stay informed, stay healthy.